Hi there. Hello, everyone, and good Wednesday afternoon. It's so good to see you as we are back together again. It's Canceling COVID. I'm Tonya Rivens, and our overall goal is to keep you and your family safe during this pandemic. Of course, in this safe space, you got real resources to address your COVID concerns and to ask questions. We are more than happy to provide answers or refer you to experts who can answer those questions for you. We want to say thank you to Mecklenburg County Public Health, mecnc.gov, mecnc.gov for their continuous sponsorship. Again, they are available to answer your questions and they encourage you, after all, just pick up the phone and give them a call. Just don't take someone's word for it. If you have questions or concerns, mecnc.gov or 980-314 9400, 980-314 9400. And also the Groundwater Solutions, Dr. Trasha Black, who is just working in the community, grassroots, working really hard to get you educated and inform them to provide services. So Dr. Black will be up in just a moment. We want to talk about one of the ways you can weigh in today. We want to hear your ideas. We had asked this before. Mecklenburg County, they've got $215 million in COVID relief funds, and they're asking for your input. So how would you suggest, what recommendations, what can be done with the $215 million in American Rescue funding? And this question, of course, was presented last night at the county commissioners meeting. They took public comments. And the comments and response was quite interesting. Several people asked for money to help struggling small businesses, which is a valid point. There is funding, or there has been funding provided through the SBA, but there's a lot of red tape to get through to get that money, folks. So that's one way, one suggestion, and especially from the county, if I can weigh in on that. I know they've got funding, but seems like the grant process and the funding through the city has been a little bit different. I speak from someone that's in the county with a business. Also from the NAACP, the Charlotte Mecklenburg NAACP last night, Minister Corinne Mack, she asked for the funding to go towards the community of color. She thought that would be a great suggestion, have it allocated for the communities of color, since this community has been hit the hardest by the pandemic. Loaves and Fishes, they made the case and asked for food giveaways for some struggling families since the economic recovery has been quite slow. So Mecklenburg County has until the end of 2026 to spend all these funds. I do know the rules and the guidelines are quite strict. And I've heard from so many of our lawmakers and our politicians and officials in the community that you have to abide by the guidelines on how to spend it. So they have until 2026. So that's quite some time to decide how and to spend the funds. Of course, if they don't use it, I'm sure they'll lose it. So hopefully they'll come up with some ways to benefit the community. I'd love to hear your thoughts as well. Share your thoughts in the chat. Some of you have commented before. 215 million is a lot of money that's out there that is to be provided and used for the community. So share some of your thoughts and comments on how you think this money should be used. Now I get to talk to someone I usually get to talk to every week. Last week we had Mr. Earl Owens III on, and I'm talking about groundwater solutions. I am so grateful for the relationship and the support. So Dr. Trasha Black, hey, good afternoon. How are you?
Hey, very good to see you. I'm wonderful.
Oh, it's
Thank you.
always good to see you too, Dr. Black, and I appreciate all that you're doing. You do a good job of helping us stay on
Mhm.
point and have a pretty good pulse on what's happening in the community. So you see it firsthand, you know what's going on.
Mhm.
Let's start with the question that I put out there. Should Mecklenburg County, the $215 million in American Rescue Plan funding, would you add some suggestions on how this funding and this money should be spent?
Well, the first thing I'd like to say is we most definitely better use the funding for something
Right.
great in the community.
Uh-huh.
When I hear that, oh, use it or lose it,
Yeah.
and we send funds back, it really upsets me when I hear the counties or the state having to return funding that was meant for the people because we couldn't figure out how to work together to use it.
Right.
So my first thing being said is we better figure out a way to use those
Yeah.
funds. I also kind of align with what Sister Corey Mack said.
Uh-huh.
Um, you know, communities of color have been struggling for a long time. I
Right.
said at the very beginning of this pandemic, people of color have 99 problems and COVID ain't one.
Right.
It's behind everything else that we have to deal with. And we have to start dealing with those other obstacles, those other social determinants of health that keep people from being well, from living well, for living in a humane way. So I believe that all of those funds need to be dedicated to the social determinants of health. And I do think that it needs to be filtered through a different system
Yeah.
than what we have historically been using, where this money comes in and it never really gets to the streets and the homes where people really need it. So I think social determinants and being managed by another organizational process besides county processes.
Dr. Black, I love that suggestion. And while you were talking, I just had this visual of these RVs that are set up for medical services rolling in these communities consistently on a schedule every
Mm-hmm.
day. And you come out, you can get cooking classes, you can learn about obesity and diabetes and high blood. Oh my goodness. Such
Exactly.
a,
Innovative things like that. That's
yeah.
exactly what we need. That's what we're going to respond to. And
Uh-huh.
that's what people are they're going to draw to that. And it's going to be something that we actually need. Sometimes we sit in these offices and we
Uh-huh.
make decisions about what we should do in the community. And you do it. And the people, once it hits the streets, we're like, well, how does that make sense?
Right.
Help me understand. But something like that would be well received, and it's different, and people want different because they're tired of
Of
the
the
same
same,
old same old.
yeah, yeah. Okay, I'm
Mhm.
not even gonna go there, "Little Baby, I'm
Yeah, that's a whole nother
tired of
topic,
being
right?
tired." Yeah, his song, "Emotionally Scarred." It's like, "I'm tired
Mm.
of tired of being tired." So, yeah,
Yeah,
we
but
got
but
another
here's how you,
suggestion.
I got, but we're doing well, and
Good,
we're
good.
tired of being tired. What are those? What about those folks who are in the shelters,
Yeah,
who are in the hotels, trying to figure out how they're going to pay that $350 for the next week or be out on the streets? They
yeah,
are super tired, and they have, but we go through those same frustrations,
uh-huh.
and so I want that money to change lives, to
Wow.
really change lives, and not just to check off boxes, but to really see the fruit from those funds.
Well, let's get these suggestions submitted. And I also want to talk about another big headline, which is the FDA has now authorized a new COVID-19 home test. It's going to soon double the nation's supply of non prescription tests. Now, you guys have been testing for quite some time. Do you see the home testing becoming the new norm for people?
I think it will probably be that way because COVID will be with us for a while.
Okay.
And so eventually insurance companies are not going to want to spend the money that will be required to have those official laboratory tests.
Uh huh.
So home collection is probably going to be the norm,
Okay.
especially when we get into systems where people are having to test. Like I've been saying, we really need weekly testing.
Yeah.
And so there will need to be possibly a home administration. But what's going to also need to be required is training on how to do that, because we've had community partners that want testing,
Mm-hmm.
and so we will come out and do a training on self-administered tests,
Right.
just because that's easier. A lot of state employees are now having to self-administer tests, and they're creating little drop boxes in state offices
Oh, nice.
for those who have to test weekly. But when they're getting to the laboratory, there are a lot of errors. There
Uh,
has to be a certain amount of genetic material for the test. And, so some folks are barely swabbing. It's just
yeah.
not, there's a much higher error rate than when you have it professionally taken. So I think as long as it comes with a lot of instructions,
Yeah.
and people really listen, I think that will be a great thing.
And obviously, it's a change. So there's a learning curve, but I'm excited about all the innovative ideas and ways that we
Mhm.
continue to grow. Now, an opinion piece in the New York Times suggests that rapid on at home tests will make pandemic life easier and more manageable. It points to the
Mhm.
703,000 deaths in the U.S. as it for President Biden to go ahead and make tests more available and more
Mhm.
affordable. And you just kind of commented on that, but obviously that is one way that it is motivation, but there's
Yeah, I think if it
yeah.
makes it easier for people to take care of themselves,
Uh-huh.
make by any means necessary, do that.
Yeah. And as I was reading that, I thought about too, something that I was so excited about is the scientists at my alma mater at UNC Chapel Hill in Stanford, they created this 3D printed vaccine patch. I'm like, oh my gosh. And it provides, the greater protection. It's supposed to be testing at 10 times greater than taking the needle in your arm. So this is like right off the press. I got it in my email and I was like, and it just looks like a little, you know how you get those sponges and you have the little tip where you can scrub? It looks
Mm-hmm.
like that with the little needle sticking out, and you just put the patch on your arm and it
Mm-hmm.
injects the vaccine. And I'm like, that's why I'm getting excited because it just shows there seems to be no limits to what our science, what science can accomplish, which is really exciting.
Exactly. Yeah, it
Yeah.
is exciting. And there are lots of medications that are being delivered now through patches or some
Yeah.
type of topical way, which
Uh-huh.
people believe that that's less invasive. It's less,
Right.
less scary than you thinking, oh, I'm going to get this needle and it's going into my bloodstream. And I
Mm,
think so. Whatever innovation is key. We
yeah.
are at a place in society where we've got to be advancing forward, and things that move us forward help us move the needle. Those are the things that we're all going to be drawn to.
Yeah.
So, I'm glad that our scientific community is not just standing still, that
Yeah.
they are consistently trying to push that needle.
Yeah, pretty exciting, a 3D printed version. So let's talk about Johnson and Johnson, and of course, they're the latest to file for FDA authorization for the COVID-19 booster shot. Are you guys doing boosters yet? And if so, I know last
We
week
have
you were
started doing boosters.
cool.
We believe that on October 1st that the boosters would be open to the entire community.
Uh-huh.
According to the CDC, that is, there are regulations for delivering boosters to everyone. And FDA, the CDA says that I can't talk today,
That's
Tanya, I'm
okay.
sorry. The CDC says that individuals who have been fully vaccinated for at least 6 months
Uh-huh.
can be eligible for a booster. Here in North Carolina, the Department of Health and Human Services is pushing that we restrict boosters to those 65 and older.
Yeah.
They can all have boosters, and those with any immune
Under
compromised systems can
yeah.
have boosters as long as they provide us documentation. So we have been administering boosters. We are pushing that boosters be allowed for those who request,
Yeah.
regardless of those having a compromised immune system, because at the end of the day, for you all out there, once you open a vial of vaccine, and depending on the manufacturer, it tells you how many doses you can get out of that vial.
Uh-huh.
So say a Moderna, you can typically get 10 or 11 doses out of the vial, whereas Pfizer, you typically get about 6 or 7 out of one of their vials. But once you open that vial, it has to be used that day or it's a wasted dose.
Yeah.
So if we have at the end of the day a vial with 6 doses in it, and then I have someone standing in front of me that would like a booster, it makes no sense for me to throw that vial away when it's the
Right.
same medication that could be used for the booster.
Didn't you
So
guys
that
have that same problem too with the vaccine when it first came out? So it seems like
exactly.
okay. I was
So
just
many
curious. I thought,
regulations, and this is who
yeah.
you're in tier 2 and you can't get it, but I have someone in tier 4, but
Yeah.
I'm about to close, so I'm going to throw this vial away, or I
Yeah.
can give these folks vaccines.
Now, did you say the CDC is they're expected to push for everyone to get it November 1st?
There are guidelines on the CDC site
Yeah.
that specifically say who is safe to receive vaccines.
Yeah.
And for everyone 18 and older, then if they have been vaccinated for at least 6 months, six
Right.
months post their second dose,
Uh-huh.
that they are, it's safe for them to get the vaccination.
Okay.
I mean,
So
the booster.
North Carolina is just a little bit different right now. Trying to
Mhm.
maybe it has to do with in moderation because of supply, who knows. But where you
And
guys
they're trying to prioritize
okay.
for who can get it. But at the same time, when you're on the front line and you have it and
Yeah.
people want it, I'm going to throw it in the trash rather than give it to someone who
Yeah.
desires the booster.
I
I'm
tell you
just,
that red tape.
again, I'm
Yeah.
telling us, think logically. Let's just be
Yeah.
logical. And it might make sense sitting at your office in
Right.
Raleigh, but that doesn't make sense on the front line.
When you're out there in the trenches. So where are you guys out today? Speaking of being out there in the trenches.
So we are in Union County.
Okay.
I think I told Earl last week to tell you all that we have a long-term site off of 74, right off of Independence Boulevard, um,
Oh, great.
at Indian Trail. So we're right off the highway. You should see the flashing signs that say COVID-19 testing. We're
Yeah.
also there with vaccination. So that's our major site. We
Hmm.
are at Kittyland. We are at University Daycare.
Okay.
And we are waiting on some information from the health department about several more sites that need to be set up for next week. So we're pretty busy, but we're excited. We're hoping to work with some of our law enforcement locally who are in the process of having those mandates in place, or mandates or testing. So we are quite busy. We're still here at our office every day. So if you need us, call us at 704-596-0505, and we are somewhere near you.
Oh, thank you so much. Groundwater-solutions.org. Dr.
Mm,
Trasha Black, is always just a joy to talk to you. So thank you so much for taking the
thank you.
time to join us. Hey, I see you guys hopping on. I'd love to see your comments in the chat. Oh, want to hear from you. Just the two of us bouncing around ideas of ways that this money could be spent. 215 million. That's a lot of funding, but a lot of work happening in our community, and it's great. I get the honor of talking to some of the individuals who are putting the work in, and my next guest is with StarMed Healthcare, Dr. Michael Estramonte. And of course, StarMed has really been working hard in the community, bringing people together, addressing a lot of the issues that we have as well. So, good afternoon, Doctor. Thank you for joining us.
Tonya, thank you for having me.
Absolutely. It's always a pleasure. And you heard Dr. or maybe you did, but Dr. Black and I were kind of coming up with our own suggestions or ideas. So maybe you want to crack at it and tell us any suggestions for this $215 million that the county has for COVID relief. Any suggestions on how you think they should use it?
Sure. I know there's a lot of great minds at work on this already in the
Yeah.
county government. But Dr. Black's absolutely right. Making sure that we don't waste any of this. Number one, but
Uh-huh.
and number two, there's such a need in the communities that were the hardest hit. I mean,
Right.
we're hiring hundreds of people every week to join our staff, and a lot of the individuals we're hiring lost their jobs due to COVID. Whether
Yeah.
they fell ill, and it really hits the reality when you're hiring somebody that's living in an extended day right now because they lost their
Yeah.
apartment lease, and this stuff has been going on it's been pretty rampant. So making
Yeah.
sure it gets into those communities that need it the most. The other thing that I want to make sure that, and I know the county government and state is very cognizant of this, but the long haulers, people
Yeah.
that have had COVID, that are going to be experiencing lifelong issues with this. I know it needs to be used by the year 2026, but getting the individuals that have had permanent damage done to their internal tissues as a result of COVID, making sure they get on the right track. I think there's going to be a significant need in the coming years for that.
That's an excellent point that oftentimes people overlook and forget about. So, first of all, thank you all for the big boom in hiring, because when you were saying that, my thought was, okay, and now these are people that will get jobs, will get benefits, and start trying to address healthcare issues that they have or may not have had, stress, the whole mental health aspect. And then you talk about the long haulers, the long term effects, and people may not even realize. So, thank you for highlighting that as well. So, let's talk about the boosters. What has the response been like at StarMed, and has it or is it difficult to get in and get an appointment?
No, it's relatively simple. There's been a gradual increase. I think there was a lot of confusion
Mhm.
initially as to who was eligible, but I think as time goes on in education and across, thanks to individuals like you getting the word out that you
Yeah.
know who is eligible for the booster right now, uh, it's definitely needed. We do a pretty decent amount of antibody tests every now and then, and you
Yeah.
can definitely see some of the individuals, especially with that had the Pfizer early on. When you look at the antibody test results, some patients don't have any left, and
Oh,
that's
wow.
not all the immunity that's involved
Mhm.
with the vaccination, but that's a good indicator that it's starting to wane.
Yeah, and that's one of the concerns, but most of the people that I know who have gotten the vaccine, they're okay with the booster shots, but there are some people saying, "If this doesn't work, I'm not going back. I don't want any more shots." What would you say to people, or kinda how could you kinda share or educate them on how the booster shot is still necessary?
Well, I mean, it's boosters have been used for vaccinations for history, for long time history. This is nothing new.
Mhm.
Boosters are nothing new. Uh, I will say of the, we have the real data. We test thousands of people every week. Of all the positive results, I want to say it's over 20% right now are those that have already been vaccinated.
Yeah.
Whether they still don't represent the highest amount of hospitalizations, but you are starting to hear more and more on the news where individuals are getting hospitalized that had the vaccine, especially those
Yeah.
that might be immunocompromised or older. So certain populations absolutely right now need to take the booster seriously if their antibodies are starting to drop off.
That's good to know, and we just need to keep just getting that information out. Now, I want to talk about something that was probably pretty close to genius when it comes to marketing, and that's the fake funeral home ad that you guys did at the Panthers game a couple of weeks ago. I heard that it increased the vaccine appointments. Man, you know, people sit back and go, "How did they come up with that?" I mean, what was their reaction, when you saw the ad and then when you saw how the public responded?
Well, honestly, my Twitter guy ran this past me over
Uh-huh.
a month ago, and I initially looked at him like, oh, that's too controversial. Just because we have to be mindful of people that have had losses, and I said, this,
Right, right.
but I don't remember how it came about, but it was of the mindset, you know what, they're going to link to somebody's website. Why not let it be ours? I'm like, I don't have a say in it. They can do whatever they want to. They can link it to the health department's web. They can link it wherever they want. They ended
Yeah.
up choosing us, and I didn't have any idea how much the national attention that was going to get.
Yeah, but you
So
had to be pleased, right?
yeah, no, it was great. It definitely awareness went through the roof.
Yeah.
And I had friends on the West Coast saying, "What are you guys doing out there in Charlotte?" And
Yeah.
it was a great. Boone Oakley was the agency that came up with the idea. It was a great campaign to raise awareness and the seriousness of this,
Yeah.
because I mean,
Yeah.
obviously this is something that needs to be taken very seriously. But
Yeah, and yeah, and then at least, I mean, we've suffered so much and experienced so much loss. If it's something that at least make us smile and there was a purpose in it, because I get it, we've all lost loved ones to COVID, but one of the things that we know we have to do is continue to live, thank God, and try to continue to educate.
no, and yeah, and you got to have a little bit of fun, right? And when
Yeah.
I got the text message from a friend at the Panthers game saying, "Is this you guys?" I was like, I didn't know that was going out today, so
Yeah.
it was a little bit of a surprise on my to be
Yeah.
honest.
So for the most part, though, I see your colleagues and everyone were asking, as far as the public, was it pretty positive response to it?
Overwhelmingly, yeah. I mean,
Yeah,
of course, there's always going to be a certain percentage of individuals that take
of
offense
course.
or are going to have a contradictory position, but 99% of the feedback was positive. So
Yeah.
our
Well, I
Twitter.
see. Good. I'm glad to hear. I mean, I thought it was great when I saw it as well too. So I see Erica Simonton Beatty has hopped on. Good afternoon. If you'd like to share what your thoughts on, I think you've shared before, but share again and any ideas of how the 250 million of county funding should be used. We'd love to share your comments and your thoughts, and others that have hopped on. Just drop some notes in our chat. We'd love to share those as well. Now, Dr. Estramonte, the last time we talked, you guys were doing the antibody clinic to treat COVID-19 patients. You were opening up one, and it was going to help kind of relieve some of the strain on hospitals. And you kind of mentioned it earlier. How is that going? And kind of give us some updates on that.
It's been going fantastic.
Oh,
We've
good.
actually we just opened up a clinic in Gaston County.
Okay.
We have some out in the east part of the state. I think we're in total five clinics so far, and we're adding one probably every couple of weeks. The inventory did drop down for a little bit, so we had to tighten up who could be eligible for the treatment. But it's the success rate on it is significant, especially if you get it when your symptoms are just starting. We're seeing
Yeah.
patients that get it, and then the next day their symptoms are completely gone. So it's a significant. I'd say it's a game changer when you get it at the right time. And what we have done recently, we've added it at our testing sites. So when somebody gives a rapid test and it's positive, we give them the option and say, "Would you like the treatment right here today at the site?" And it does involve a little bit of education right on the site.
Mhm.
As of right now, most of our referrals are actually coming from other doctors' offices in the hospital system.
That's interesting to hear. So that's what the bulk of the population that is visiting you for or visiting the clinics, they're mostly referrals.
Yeah, I'd say probably somewhere around 60, 70% of them are actually coming from other healthcare professionals educating their patients when they call up and test positive. The other ones do come from directly from the people that are getting tested in line, and so it's a good mix. But more people need to know about it, and hopefully it becomes more available in the near future.
So that's another suggestion on that funding that they have is educating the community about these antibiotic clinics and how to understand, how it works and how the treatment works. So I really appreciate that. And that's exciting. Like I said, I just think that, we can only continue to evolve. And I say we like I get credit, certainly not me, but the science of everything is just really phenomenal. And it's exciting because we're pushing forward, which is what is needed to get more and more people vaccinated or to understand what we're dealing with. So as we wrap things up, doctor, is there anything else you would like to share as far as StarMed? You mentioned open up in Gaston County in the eastern part of the state. More plans for expansion or anything else that you would like to share?
Oh yeah, certainly. We're adding permanent. We're in 28 different counties across the state right now. We're adding
Okay.
permanent sites for the immediately right now to handle the need. And you do play a huge part in this, Tanya. I wanted to make sure you getting the word out on everything we touched on, and everything you touched on with Dr. Black is absolutely huge because a lot of people don't understand all the things that we just covered. So
Yeah.
thank you for taking the time to do this.
Well, thank you. And I ask everyone when they hop on, please share so we can keep the conversation going. Maybe people can't watch at 1 o'clock, but if you just share the information, we'll continue. So, Dr. Estramonte, I appreciate you again and what you're doing. StarMed.care is the website, StarMed.care. And you're always gracious enough to join us whenever we ask. So, thank you again for taking the time.
Thank you. Bye bye.
Absolutely. Hey guys, as we start to wrap things up, I do want to share this. We had a loss, and every loss of life is regretful, and especially if someone has an opportunity to get a vaccine and they just won't take it. They just totally don't understand, and they've made up their mind. I lost someone in my community where I grew up, and I understand she had COVID and she would not take the vaccine. I don't know the situation for this individual, but I know that CMPD is mourning the loss of a 28-year-old veteran. He had served 28 years, given his service to our community. Mr. Julio Herrera, who was a resource officer, he transitioned and passed away. And his wife said that he had been battling COVID. So, of course, thoughts and prayers out to all of the lost lives that we continue to see. These losses now over 700,000. And so, again, I'm not implying anything anywhere except for when we're losing life to COVID. That's one of the things that we are trying to cancel. We're continuously working at it, and we appreciate you hopping on, sharing your thoughts, sharing your comments, and sharing this show so that we continue to get the word out. Also, one of the other I guess, facts that I saw is about people that are being reinfected with COVID-19. It says now in Mecklenburg County, about 1% of those people, these breakout cases where people who have gotten the vaccine and then they come back and test positive again, it's showing less than 1%, which was the latest figure that I had that came out on Monday. So we're making progress. I shared with you the 3D printed vaccine patch, which is so impressive to me. I'm telling you, it does. It looks like, and maybe you guys don't hand scrub things, but there's a one little gadget that you put on your index finger, and on the tip of it, it has all these little pointers, scrubbing, whatever you might call them, and you can take them and just scrub. That's what it looked like to me. Like they just took it a little rectangle, a rectangle, and created this. And so who knows? At some point, these anti-vaxxers might just curious and say, I want to give it a shot. And certainly that could only help the entire community. Time for me to wrap things up, folks. As always, life's challenges make you better, not bitter. Remember, we kicked this off in January. We're still at it. We got some exciting announcements coming real soon to get more and more people involved, more and more people responding, and certainly more and more people getting this information, which is what we are here for, to give you real talk, resources, and an opportunity to help you navigate this thing called a pandemic. Thank you again to our sponsors, Mecklenburg County Public Health, mecnc.gov, mecnc.gov. And thank you again to Groundwater Solutions and Dr. Trasha Black. We've got some liquid sunshine in the forecast. I'm not exactly sure when we're going to get it, but make sure you stay dry, enjoy yourselves, stay safe, and most importantly, thank you for tuning in. And together we will cancel COVID. Have a great afternoon, everyone.